Hi, Dr. Windisch again. Welcome to our unscripted video series for patients and patient education. Today we're going to talk about some issues with breastfeeding, specifically things that can be transmitted from mother to baby in breast milk. Please remember that these video series is in no way meant to replace a consultation with your physician. If you have concerns, if you want to be seen, make an appointment with your physician. We would be happy to see you here in our office. 775-359-7111, and even as a new patient, we'll be happy to get you in the same day if you're having concerns. So what are some things that can come across in breast milk and affect the baby, for positive or for worse? Well, there's a whole bunch of things, so we'll start with some of the positives. Certain essential fatty acids can absolutely come across in your breast milk, in particular something called DHA and arachidonic acid, or ARA. These are fatty acids that are then converted to other chemicals in the human body responsible for proper immune functioning. To this end, we do recommend that all mothers who are breastfeeding take either a prenatal vitamin with DHA and ARA in it, or a DHA-ARA supplement like Expecta. They're available over the counter. You don't need a prescription for them. You can use fish oil supplements instead. They absolutely work as well, and unfortunately they kind of taste like fish. The not so pleasant things that can come across in the breast milk, fortunately, tend to be rather benign, meaning they don't cause a whole lot of problems for the baby, but it's important to know about. More importantly, it causes a lot of anxiety for the parents, so I do want you to understand exactly where we are with these things so you can make an informed decision as to what to worry about. Certain diseases are absolutely transmitted in breast milk, and many physicians, myself included, recommend not breastfeeding if you have one of these diseases. These diseases include, but are not limited to, human immunodeficiency virus, or AIDS, HTLV1 and 2, human T-cell lymphotrophic virus type 1 and type 2, close cousins to the HIV, hepatitis B virus, and hepatitis C virus. Hepatitis A virus is not transmitted in breast milk and is not a problem. But if you have HIV, HTLV, Hep C, Hep B, personally I recommend strongly you not breastfeed because the risk of transmission in these diseases is high. You may want to talk to your physician about that if you have one of these diseases, but that's my recommendation because these diseases are not curable. If your infant gets them, there is no going back. Certain medications are transmitted in breast milk. The ones that are transmitted in quantities that we worry about, fortunately, are very few and far between. So we're going to talk about those first, and then we'll talk about others that come across but are realistically not a problem. Transmitted in large quantities that can create problems for the infant include all chemotherapy drugs. So if you're on chemotherapy drugs, including methotrexate for rheumatoid arthritis, you absolutely cannot breastfeed. Small amounts of methotrexate create large amounts of problems for a developing baby, so those drugs are an absolute contraindication. Radioactive drugs, including radioactive iodine, radioactive cesium, radioactive calcium, come across in the breast milk. Again, if you're being treated for with radiotherapy, with radioisotope therapy for anything, you cannot breastfeed. However, most people who are being treated with radioisotope therapy are so sick, they're not breastfeeding. Propithiouracil, a drug for low thyroid or hypothyroidism, can come across in the breast milk. Your endocrinologist will not want you to breastfeed if you're on PTU. However, PTU's competitor, tapazole or methimazole, is generally safe to take when you're breastfeeding. Having said that, certain adult endocrinology experts in my community recommend even patients on methimazole not breastfeed. That's between you and your endocrinologist. Personally, I'm not too terribly concerned. Certain antidepressants come across in your breast milk. Some of the very old antidepressants called monoamine oxidase inhibitors, or MAOIs, come across in your breast milk. The good news is these are rarely, if ever, used anymore, and chances are you're not going to be prescribed one. Some of the second generation antidepressants called tricyclics, like Elavil and imipramine and norepinephrine, come across in breast milk. Most pediatricians recommend, if you're taking these drugs, similarly, you not breastfeed. Finally, the newer and more common antidepressants, the selective serotonin reuptake inhibitors, which include but are not limited to Prozac, Zoloft, Celexa, Lexapro, Paxil. They come across in your breast milk. However, in general, they're felt to be reasonably safe for a mom to take who is breastfeeding and reasonably safe for the baby if mom is taking when she's breastfeeding. Similarly, drugs like Valium and Ativan, which are taken for anxiety, can come across in breast milk, but generally don't cause a problem for the babies. Certain pain medicines can come across in your breast milk, including but not limited to codeine and hydrocodone or Vicodin. Again, the risk of this creating problems for the baby is very rare. If you are on Vicodin, talk to your obstetrician about it. There have been some very, very rare reports of large quantities of hydrocodone coming across the breast milk, creating some problems for infants. Having said that, these reports are very few and far between, and it's not well established whether they're for real or not. But do talk to your obstetrician about that. Certain vitamins can come across in breast milk. This includes vitamin D, and is a good thing for the baby. Antibodies come across in the breast milk. If you are breastfeeding, receiving a flu vaccine is a very good idea. Your infant, if they're under 6 months of age, is too young to receive that vaccine, they will get antibodies from you. So by being vaccinated, you can protect your infant who's too young to be vaccinated. Certain drugs that we use to promote breastfeeding, including a herb called fenugreek, can come across in your breast milk. Now, fenugreek is used to enhance breast milk supplies, and it can come across in your breast milk and then is excreted by the baby's urine or the baby's kidneys into the urine. Fenugreek for the baby is of absolutely no consequence, but it will give the urine a funny smell, kind of a maple syrup with urine kind of smell. And if you smell that and you're on fenugreek, you'll know what it is, and you know it's nothing to worry about. Most antibiotics are safe to take when you're breastfeeding. Okay, this includes everything that your obstetrician might use to treat mastitis, a common infection in breastfeeding women. The one antibiotic exception that we recommend you not take when you're breastfeeding is something called, now I'm going to draw a blank, something called Flagyl. Fortunately, we only use that for very rare infections and generally unusual infections. And if you're breastfeeding, your obstetrician needs to know about it. He or she won't prescribe you Flagyl or metronidazole, and that'll avoid that problem. But drugs such as amoxicillin, Augmentin, doxycycline, Septra, all of which are used to treat breast abscesses and mastitis and other common infections, are absolutely not a problem when you're breastfeeding. They're either not excreted in the breast milk or they're not excreted in quantities enough to create any issues for the infant. Certain foods can absolutely come across in your breast milk. That includes things that tend to produce a lot of gas. So the babies can wind up getting a lot of gas from the foods. This includes if you're eating a lot of things like cabbages, onions, cauliflower, broccoli. If you're eating a lot of spicy foods, it can absolutely cause reflux for the babies. This includes cooked or raw tomatoes, real spicy things, peppers, etc. Not every baby gets reflux from this, but if your baby is a refluxer, eating those foods when you're breastfeeding has the potential to make it worse. If you start noticing a trend, then you may need to cut those out of your diet. If there's no connection or no problem, then by all means eat a regular diet. I know this is a lot to digest, so to speak, in a short period of time. Again, if you have questions or concerns about what you're taking or what you're eating as you're nursing your baby, please make an appointment to speak with your pediatrician or your obstetrician. We would much rather discuss these issues with you than have you simply stop breastfeeding. And most of the time, these issues are not a major issue and shouldn't preclude breastfeeding. We'd be happy to see you here in our office, area code 775-359-7111. If we can be of assistance, please give us a call.